What's up, guys? It's Dr. Murphy of Murphy Medical Associates and our team at coronatestct.com. coronatestct.com. I am back from the mean streets of New York City with an up-to-date report for you on the New York City variant. That's right, the New York City variant. I'm going to keep it brief. We're not going to have much more than 6 minutes to go over this. But if you want to hear about New York, and the New York City variant, stay tuned. All right, guys, I don't know if you remember this lovely little homage that I gave so I could refresh your memory of the spike protein, right? The spike protein from SARS CoV2 and the receptor binding domain. That's the grabby spike protein receptor binding domain. Then you have your N-terminal domain here for stability. Rawr. Come here, right? So what we're seeing now is we're seeing a big push for opening up. We're seeing a big push for opening up, predominantly coming from Connecticut. Governor Lamont has said, coast is clear, let's open the restaurants at 50%. Coast is clear, we're vaccinating everyone, we're doing a great job doing it. So why not? Why not? You know, while I tend to be an optimist on most things, I'm also a realist when it comes to human behavior. I'm a realist when it comes to human behavior. And as I know, one of my kids is rapidly approaching a break, and one of the parents there is setting out a bowling outing. I'm a little nervous, and I think I made mention of that in the last podcast, the last stream I've had, right? Let's transition back. We have a minor glitch. We have a minor glitch showing up. So sorry I couldn't give you any more advice. I went radio silent for a couple of minutes while I thought through what's going on. And we had a little microphone mix-up. So thanks for hanging out during that microphone mix-up. Here's the problem. Here's what we see. We see the new hotspot. What's the new hotspot? That's right, it's New York City. It's New York City. So if you look at one of the candidates for the Manhattan Borough presidency, Mark Levine, he hits the ground running. We know the New York City variant is spreading. We know it's spreading. And what does he say? He says Connecticut is surrounded by 3 states in the nation with the highest case rates: New York, New Jersey, and Connecticut. And tomorrow, Connecticut is lifting all capacity limits on restaurants, retail, libraries, personal services, indoor recreation, gyms, museums, offices. What could possibly go wrong? What could possibly go wrong? Well, I'm here to tell you right now, thank goodness Thank goodness I was able to go to New York City today and review what's going on in New York. What's going on in New York. And I can tell you there's a big push to vaccinate everyone. There's a big push to vaccinate everyone. And we're seeing that in New York City. They are ramping up vaccination efforts massively. I know. I was there today. Why did I have to go to New York City to get vaccinated? Well, number one, my practice is in New York City as well, right? We've got an office at Broadway, 65 Broadway, which is right down in Battery Park. So we have an office in Battery Park. I tried to get the J&J vaccine in Connecticut. I tried to get it in Connecticut. I tried to get it through Stamford. I tried to get it through Hartford. I tried to get it everywhere, and guess what? Nope. Couldn't get the J&J vaccine. I couldn't get the J&J vaccine. And I don't quite know why I couldn't get the J&J vaccine, especially when you take a look up there at what is going on. What is going on? Here's what's going on. 50% of samples in Columbia are now testing positive for the New York City variant. And I don't know if you guys remember or not, but with the New York City variant with very similar data to the South African variant. Very similar data to the South African variant. So you could see from the South African data that the AstraZeneca vaccine completely escaped, the South African variant escaped the AstraZeneca vaccine, and they shut it down, right? I'll show it back to you again. You guys want to take a look. So that's the South African variant. The South African variant had some protection with the J&J vaccine, but the New England Journal of Medicine article points out that the AstraZeneca vaccine did not protect against the South African variant. What did? The J&J and the Novavax. The J&J and Novavax had data on the South African variant. Why does this matter? This matters because the Johnson & Johnson vaccine is covering a variant that has the E484K E484K mutation. Why does that matter? Why does that matter? That matters because the New York City variant has the E484K mutation. It has the 484K mutation. So we have to assume, and I think in a reasonable zone, we have to assume that the E484K mutation allows escape. I'm trying to put together in my head how J&J was able to cover, partially protect, and 100% protect against the South African variant's mortality and hospitalization. Yet AstraZeneca evaded it. AstraZeneca evaded it. I have to say to myself, why did this happen? I can't wait for the data. But I can feel very confident in the Johnson & Johnson vaccine protecting against the South African variant. It also had Brazilian protection as well. The Pfizer vaccine has laboratory data that shows Brazilian and South African escape. So I didn't want the Pfizer vaccine. The Moderna vaccine, we are getting reports, and I'm seeing it myself, of people who have delayed reactions, who have Moderna arm. What we need to recognize is the Moderna dose is very high and can probably be reduced. The Moderna dose, again, is very high. People are going to have to wait. So the Moderna dose is very high. Because the Moderna dose is very high, sorry about that, guys. Because the Moderna dose is very high, I have to really, sorry, I apologize. I'm getting a text from the hospital. I got to handle that. All right, handled. So, because the Moderna dose is high, we are worried about Moderna arm. It's not going to paralyze you or make horrible problems, but it was a side effect I didn't want. So I waited for the J&J vaccine. I went to Chelsea. I signed up online. Well, second off, why I had to follow a Twitter post to be able to know that I could get Moderna, a Twitter post to know that I could get Moderna. Like, so I had to follow on Twitter till a doctor pointed out that in Chelsea they were offering the J&J vaccine. Okay, fine. Okay, fine. So I go down to Chelsea, easy, park the car, walk to the NYC building where they're having a vaccination drive, which was, I think, very fair. I also, by the way, shared it with NYC to make sure that they shared it with everyone as well. For those who don't know, we worked with NYC in Brooklyn for a while to take care of the underserved. So they have a vaccination center there with lots of open slots. I let all of my patients down there know that they're offering the J&J vaccine. I show up there. Well, it's not for healthcare workers. Sorry, if you're a healthcare worker, you are disqualified from getting the J&J vaccine. What? You're disqualified. So luckily, I'm also a caretaker. And so I'm a child caretaker. And so because of that, I was able to be eligible for the J&J vaccine. I went and received my vaccination, which I believe will offer a modicum of support and protection against the South African variant because we have data for it. Can I make the two-jump leap that the New York City variant has E484K, just like South Africa and Brazil does, and the J&J vaccine is going to protect me? We don't have data on that. But as a clinician, I have to say, risk versus benefit, give me the J&J vaccine. And guess what? I got it today. Boom. J&J vaccine. I received the J&J vaccine today. And the reason why this matters to me is right up there. New York City is becoming a hot spot. New York City is becoming a hot spot. And what we know, put simply, is that the New York City variant B.1.526 carries the E484K variant. The E484K variant in the receptor binding domain. That's a receptor binding domain that grabs you. That variant, the E484K variant, is giving people fits. It's giving people fits in Germany, and they're going to lock down again. The B.1.1.7, the UK, the variant isolated in UK, it's giving people fits. But Pfizer and Moderna have protections against that. It works. We found that there is a scramble. Luckily, the United States and the UK were able to purchase their vaccines first. Large organizations move slowly, and the European Union moved slowly with acquiring vaccinations. Therefore, they're a little bit behind the eight ball. Does it mean we're not going to get the wave that's coming that is in Europe right now? No. We're going to get that wave. This is Dr. Murphy. I'm telling you, we are going to see a regional wave. We're going to see a regional wave. And it appears to have its start right here in New York, New York. I think the B.1.526 variant is going to climb. The B.1.1.7 is in New Haven, and it's lighting up New Haven, squeezing places like Fairfield County. Connecticut has Rhode Island on one side and New York and New Jersey on the other side that are starting to become on fire. We saw this last time, 1 year ago. We're going to see it again. We need to flood the zone with the J&J vaccine. I think we need to flood the zone in Connecticut with the J&J vaccine, and we need to not discriminate on who receives this vaccine. We should be pushing this to everyone. because it has a modicum of protection against the South African variant, which may not be here, but the E484K mutation sure as crap is here. E484K is here in the B.1.526 variant in about 50% of the samples sequenced at Columbia. It's time for the next wave, guys. We need to get vaccinated. We need to test, treat, isolate, and trace. Insurance companies need to pay for that testing. Yes, they do. Or the federal government needs to pay. Or they both need to pay. Because if you can't test, you can't do the rest. If you can't test, you can't do the rest. I want to thank the Grubau Lab, Yale School of Public Health, working with us to sequence in Connecticut and New York. We'll find these variants, we'll protect Connecticut, and we'll vaccinate everyone. That's what we have to do. Governor Lamont, if you're listening, we have an order in for thousands of doses of J&J. The moment you get them into our hands. We'll make sure everyone gets vaccinated. Mark Levine, in your borough presidency, good luck on your candidacy. Good luck in your candidacy. Thanks for pointing this out. We've got to flood the zone with J&J. New York City's got to be flooded with J&J. It was today. This is Dr. Murphy Medical Associates, our team at coronatestct.com. I am wrapping up this live stream. Today is March 19th, 2021. 1 year ago today, we were dealing with a pandemic in New Rochelle and New York City. People dying left and right. We're in a better place than we were last year, but we're going to repeat those mistakes if we don't get our heads on straight. Stay out of the bars, stay out of the bowling alleys, and stay out of the restaurants unless they can properly ventilate. I love you guys. This is Dr. Murphy Medical Associates, and our team at coronatestct.com. Signing off for the Murphy Medical Minute. Thanks for tuning in. Love you guys. Stay safe. And remember, we are made to be well. With